Welcome to OakLeaf Surgical Hospital. We look forward to meeting you for your upcoming surgery. In this video, you will find useful information for you and those helping to take care of you when you are home. Some items we will cover in great detail, and others you will be just introduced to, as they will be covered in more detail during your stay. If you find you have questions about home safety, equipment needs, or the ability to manage the post-operative routine, we suggest that you speak to your physician about a preoperative physical therapy visit. At that visit, a physical therapist can educate and assist you in getting your discharge planning for home all taken care of, including a walker, crutches, bathroom equipment, and to teach you your exercises. The more you are educated and prepared, the smoother the hospital stay and rehab at home will be. All right, we are going to get started with the information you need following your hip scope surgery. So right now you have your ice pack in place and you have this CPM machine in place. Either you have this machine waiting for you at home, which some people do, or you can take this one home. So we can talk about that in a little bit. But either way, you need this machine when you go home. It's been running all night and it continues to run, and you want to use it simply like it is set up now. You don't have to make any adjustments to the machine. You've got your representative that you can call from the company itself. So if the machine has any issues or problems, call them directly. But otherwise, the purpose of this CPM machine is simply to bend and straighten your knee and your hip. Your leg should be as relaxed as you can. You don't want to feel any stress to your hip, so that's why we don't want it to run very fast. We don't want it to bend really high. It's more than anything helping just to move the swelling around, as well as provide some motion so that the hip and knee don't get very stiff. Each unit has its own mechanism of how to operate it. You'll leave here today with a troubleshooting sheet on operating the machine and the parameters as far as range of motion that you should use. So I'm going to let the machine straighten all the way out, and it's a little easier to take off when the machine is straight. When you're using it, you do need your upper body to be completely flat, because if you're propped up, that changes the range of motion of your hip. So plug in a good movie and lay back and let your leg go for the ride while you're using this machine. I'm going to take the machine off and take the ice pack off as well. So I'm going to have you lift up your leg. I'm going to slide that machine out of the way. Set your leg back down, just let it rest. So the other piece of equipment you have is your ice pack here. They've got it on over your shorts, which is fine. You want to make sure you have at least one layer of either a cloth or a pillowcase or something so your skin doesn't get too cold. So I'm going to undo this Velcro strap and undo the ice pack, and then I'm just going to slide it out of the way. So the ice unit itself goes home with you, ice cubes and water in there, and then it does need to be plugged into electricity so that it can pump that cold water to your hip. I'll give you a handout with how much ice you should use during the day. So what we're going to do now is we're going to go through your exercises. First thing I want you to do is I want you to pump your ankle up and down. You want to pull up far enough that you get a little bit of a stretch in your calf, and you want to point down far enough that you get a little stretch across the front of your ankle. So you're going to continue with those ankle pumps and just move through the range of motion to stretch that leg out. I'll give you a handout today with all your exercises on it, so you'll know how many repetitions and your frequency per day as far as doing these. All right, second exercise is going to be for the quad muscle on the front of the leg. So go ahead and tighten up this quad muscle, which means you're going to push your knee down and then relax. And then tighten your muscle and relax. You might get a little pulling across the front of your hip with this. Go ahead and tighten. And that's normal. And it actually might even feel good. Don't be alarmed by that. And then relax and do one more repetition. Excellent. Next exercise is going to be for the glute muscles, for kind of the back side of that hip. With both left and right, go ahead and squeeze those glute muscles together and relax. This one can be a little more sore, a little more work done in this area. Go ahead and tighten and relax. Tighten. Very good. And relax. Last one. Great. All right, the next exercise is going to be for your hamstrings. For this one, we're going to bend up your knee. Yep, just like that. And then what I'd like you to do is you're going to use your hamstrings, which are on the back side of your thigh, and I want you to pull your heel towards your body, kind of dig it into the mattress, and then relax. Pull the heel in and relax. Pull in and relax. And one more time, pull in. Very good. And then stretch that leg all the way out. The last exercise you're going to need a helper with. So that helper is going to want to be at your thigh and at your ankle, and they're going to roll your leg inward. So I'm going to roll the whole leg like a log inward, and then I'm going to roll out. And I'm going to do the work for you. You try to relax as much as you can. I don't want you to do this one on your own. I would like to try to have someone help you with it. So whenever someone's available, have them help you with this exercise. And one more. Excellent. We are going to go ahead and we're going to get you up to the edge of the bed. Once we get you up to the edge of the bed, we're going to go through the wrap that we need to do on your hip for swelling, and then we're going to talk about your weight bearing as well. So I'm going to go ahead and I'll help you with that leg, but we'll get you sitting up on the edge of the bed here. I'm going to put your bed down. Okay. You can go ahead and start to work yourself to the edge of the bed. Yep. And then scoot forward, and then just kind of square yourself up on the edge and let that leg dangle over the edge. There you go. You brought your crutches with you today. So you have a weight-bearing restriction based on your surgery and your surgeon that gives you a certain amount of pounds of pressure that you can put through your leg. So we're going to use a bathroom scale, and you're going to step onto that scale until you get to that amount of weight. And then once we've practiced that a couple times, you'll kind of have an idea of how much weight you can put through your leg. You want to make sure that you don't put more than that, because there is a risk of a stress fracture or a stress irritation. And you don't want to be less than that, because you need a certain amount of weight to make sure that the tissues are healing appropriately. So that weight-bearing restriction that we give you is in place until your physician or physical therapist tell you otherwise. Even if you're feeling great, stick with the weight-bearing restriction. So let's pull this scale over. A regular bathroom scale will work at home. And let's put your crutches on this side. And you can go ahead and stand up and then switch your crutches so you get them under your arm. And step forward a little bit, and then put that foot and step down. Yep, and then kind of lean off and step down. There you go. So you kind of get the feel of how much pressure can go through that entire leg. So in a minute, we'll go walk in the hallway, but you want to think about what that feels like so that you can mimic that every time. All right, you can pull your leg back off of there. And just go ahead and stand there for a moment. I'm going to get that ACE wrap, and we're going to wrap that leg like I mentioned before. So this ACE wrap will go home with you. Now I'm going to wrap it over your shorts today just so that you know how it goes on, but you are going to want to do this as close to your skin as possible. So after your shower, you're going to want to wrap this on your leg. Have you ever done this hip spiker wrap before? It can be a little cumbersome, but we want to start at the bottom and work our way up, and you got to be careful not to put too much weight on your leg while we're standing here. So I'll try to move quickly as quickly as I can. So we start by getting the Velcro fastened, and then you just want to do kind of a figure eight, or not a figure eight, sorry, just a spiral wrap around your leg. I'm going to go one more time, up around your hip, and then I'm going to come around your waist, because that's what holds it up so that it doesn't slide down. So I come around your waist, okay, and then I'm going to come back down with whatever I have left. This is kind of a long wrap, so you do end up coming back down, and then there's a Velcro tab, and you stick that to the back. So you're going to need to rewrap this probably a couple times per day. It will get a little loose, it will slide up and down, but you're going to want to keep this on. Helps get the swelling out and kind of gives you that feeling of a little compression to the hip. And then to unwrap it, you simply do kind of the reverse, and you can save yourself some time if you just wrap it up as you go. So you're going to have some dressings on your hip, like gauze and tape. This goes right over the top of that. The other option would be that you can wear compression shorts. So if you prefer, you can wear long compression shorts, and then you don't have to do this wrap. So either option is fine. All right, we're going to take a few steps here. So we want to remember that weight-bearing restriction. I want you to move your crutches forward, yep, and your surgical leg, and then your good leg, yep, and your crutches, and then your surgical leg, and your good leg. Good. All right, so we're going to walk down the hall so we can go practice those stairs. So I want you to put your crutches forward, and then your surgical leg, and then your good leg. And remember, stay inside that weight-bearing restriction. Don't put too much weight through that leg. If you do have a little pain, you can back off on the weight a little bit, but otherwise I want you to use those pounds we talked about. There you go. A couple more steps. Excellent. Good. All right, we are going to go up into this, up the stairs, like getting into your house, or even if you have to navigate a curb. So to do that, I want you to go ahead and go up with your good leg, then bring your crutches and your surgical leg to meet. Yep. Up with your good leg. Come across this platform here, and then we're going to go down a couple steps. So your crutches come down, surgical leg comes down, yep, and then your crutches and your surgical leg, your good leg, and then one more time, and you're all set. All right, so now we're going to go up the stairs, but we're going to go up using the railing. If you use a railing, take your other crutch and tuck it in next to your other one so that when you get to the bottom of the stairs, you can just continue walking. So you're going to go up with your good leg first, bring your crutches and your leg to meet. Yep. Up with the good leg. This way you can really lean on that railing if you need to. It's a bit more sturdy than the crutches. All right, crutches come down. Surgical leg, good leg, crutches, surgical leg, good leg. One more step, and then bring that crutch around, and then that way you're all situated and you can take off walking. Hopefully the information you've gained here today has been helpful to you and your family members as you prepare for your upcoming surgery. If you have any questions regarding any of the information, please reach out to one of your providers. On behalf of OakLeaf Surgical Hospital, we wish you the best for a speedy recovery.